Hi everyone. Today we will start the lecture on the largest internal organ of the body. It is soft, it is solid, it is friable, and it is vital. That is necessary for the life. Yes, I am talking about the liver. So we will start with the anatomy of the liver. The Greek word hepa is used for the liver. So the term hepatic is derived from the hepa, so liver. Word hepa is Greek word. So the word hepa is used for the liver, and in many places the word hepa replaces the word liver. So we use hepatomegaly when the size of the liver is decreased. So well shaped, roughly triangular organ. It is the largest internal organ, but not largest organ of the body. The largest one is the skin. So skin is having first place, and second is the liver. The weight of the liver is roughly 3 pounds. But when we talk about the range of the weight, 1.4 to 1.8 kg in male. In case of female, it is 1.2 to 1.4 kilograms. Covered by the serous membrane, visceral peritoneum, and it moves with the respiration. It is entertaining the protection of the rib cage. So when we see the exact location of the liver, this is the manubrium. Rib number 1, rib number 2, rib number 3, rib number 4. Rib number 5, rib number 6, and rib number 7. The remaining lower ribs are not attached directly to the sternum. So these ribs are true ribs. Rib number 8, rib number 9, rib number 10. all are sharing a common cartilage. In same way, here also rib number 8, 7, 8. This is the rib number 9. And rib number 10, all are sharing same cartilage. Now between, this is first, second, third, fourth, fifth. Between the rib number 5th and 6th, this is the 5th intercostal space. 5th, I see space. So when we see the exact anatomical position of the liver in the rib cage, this is the first intercostal space. This is the exact location of the liver in the rib cage, entertaining protection So the uppermost part of the liver is reaching up to 5th intercostal space. Up to 5th intercostal space. And running towards left, crossing the midline, and in the left part reaching up to the left mid clavicular line, up to the medial part of the mid clavicular line, or just medial to left nipple. So this is space of the cage, rib cage, is occupied by the liver. Now we can see here it is having two lobes. Larger is the right lobe and smaller is the left lobe. The larger is much larger and it is around 5 to 6 times larger than the left lobe. So 5 to 6 times larger. The left lobe and the right lobe. So the right lobe is 5 to 6 times heavier than the left lobe. Left lobe is smaller and reaching up to the left mid-clavicular line. The lowermost part of the right rib cage is covering the lower border of the liver. In some cases only, not always, in very some individuals, it is descending downwards below this rib cage. So descending below the rib cage. It can be palpated in some clinical conditions or some pathological conditions below this right hypochondrium, but in normal individuals it can be palpated here in the infra-sternal angle or this angle. This angle is also known as gastric angle. So we can palpate the liver here. Now, why the anatomy and some abnormal conditions of the liver are so important for clinicians, for surgeons, and for the individuals also? It is a vital organ. What is a vital organ? Vital organ is the organ of the body. Life is not possible without that. If there is no possibility of life without an organ, the organ is the vital. So organ is vital. Yes, like brain, heart, the kidneys, liver is also vital. And liver is the highest seat of metabolic activities. It is not only largest internal organ, but it is the highest seat of the metabolic activities. Why it is the highest seat of the metabolism? The liver is related to many types of activities, and you may know many things about liver, but there are only few things which should always be remembered by a clinician, by a surgeon, or by a medical student. What are these things? Simply, this is liver. Simply, this is liver. In one word, this is liver or hepa, but it is related to digestion. So how it is vital for life? It is related to digestion. Many digestive activities are performed by liver, and liver develops from the foregut. Liver develops from the foregut and septum transversum. Upper part of the liver is covered by the diaphragm. So diaphragm is separating the liver from the heart and the lungs. In upper part only. Lower part is covered by the visceral peritoneum. So upper part is covered by diaphragm. So liver develops from the foregut endoderm. And septum transversum. So it is related to digestive activities. It is involved in digestion of the fat, the proteins, the carbohydrates, the minerals, and the vitamins. The second important function is the metabolism. Involved in many types of metabolic activities like the synthesis of proteins. It is having endodermal part. It is also having the exocrinal and endocrinal. So it is having exocrinal and endocrinal parts. It is involved in the synthesis of plasma proteins like albumin and other plasma proteins, except some immunoglobulins. So what types of synthesis? Metabolic activities. the synthesis of proteins. Proteins are forming the hormones and enzymes, and also forming or maintaining the viscosity of the blood by plasma proteins. So proteins, so cholesterol is having typical steroid nucleus, which is forming some steroid hormones. So liver is working as a metabolic center, synthesizing proteins, cholesterol, the clotting factor. The clotting factor. So liver is involved in digestion, secreting bile. The bile is the end product of the heme metabolism. When the worn out RBCs are coming in the liver, these RBCs are uptaken by the hepatocytes and globin is utilized for protein synthesis, and heme part is forming the bilirubin. Bilirubin is an ingredient of the bile. So bile is having bilirubin, bile salts.